Good day. My name is Dr. Gabrielle Swan. I'll be presenting my grant proposal on the EMS Substance Use and Abuse and Mental Health Training Program. The Purdue Extension in Clinton County, Indiana is seeking a grant to assist with the funding for the EMS Substance Use and Abuse and Mental Health Training Program with the objective of training all EMS personnel in rural hospitals in Clinton County, providing them with the tools and the skills that they will need to adequately manage patients with substance use and abuse and mental illness. The Purdue Extension Organization in Clinton County, Indiana, is the county's branch of Purdue Extension. Purdue Extension is considered a nonprofit organization that was founded in 1914 to enable the dissemination of research from experiment station to local residents. The mission of the organization is to deliver practical research-based information that enhances the lives and livelihoods. The organization provides services to over 680,000 plus residents of Indiana in the 92 counties. The organization's administration staff govern the organization's program areas. There are 4 staff members in the Clinton County Purdue Extension who run the programs, which include the office manager, the county extension director/educator, the secretary, and a program advisor. Some of the key programs under the health and human sciences sector, it includes the mental health program, the financial resources for higher education, and health and nutrition. According to the 2021 Community Health Needs Assessment, a high percentage of Indiana adults reported receiving treatment for counseling for many mental health illnesses. However, a lower percentage of reported improved functioning due to treatment received compared to the national average. For Clinton County, 16% of the population reported frequent mental distress, which was higher than that of the state's percentage at 15%. Clinton County's ratio of mental health care providers to patient is 2,310 to 1, was higher than that of the state at 1,012 to 1, which can also be attributed to the low percentage of improved functioning by the patients who had received treatment. The community needs for increased availability of mental health care providers is an important issue because it is an indicator of access to health care, and improving access to adequately trained mental health care providers can potentially reduce poor health outcomes for those patients. As emergency medical services are usually the first responders on emergency cases, as well as providers of urgent pre-hospital treatment and stabilization, it is imperative that they are equipped with the tools and the skills that they need to adequately respond to substance use and abuse and mental health cases. The program's training will be provided via the SAMHSA's Addiction Technology Transfer Center. In the program, there will be various activities to ensure that the EMS personnel are adequately equipped to manage the patients. Some of these activities include EMS personnel being trained on the use of FDA-approved opioid reversal medications in emergency overdose situations, learning procedures to connect those undergone overdose reversal to substance disorder treatment, learning to use motivational interviewing to engage individuals while also providing referrals to treatment, developing procedures to ensure all overdoses are reported to the state and our local public health department. The EMS personnel will be recruited from local rural hospitals. The training program will be approximately 4 months, with a new cohort 1 month after the previous group's completion of the program. The staff of the program will include 1 project director, 2 assisting staff, 2 mental health consultants, and 2 mental health nurses. After the completion of the program, there will be 30% increase in filed patient reports of substance use and abuse and mental ill patients reported by rural hospitals in the following year. In addition, 60% of the trainees will report changes in their assessment and management of substance use and abuse and mentally ill patients via positive changes in their pre- and post-test surveys. The overall expected impact of the program is to increase access to quality care for substance use and abuse and mentally ill patients through the increase of trained EMS personnel in the rural communities. The proposed process of evaluation includes a process of evaluation and outcome evaluation. The functioning process of a program will be evaluated at the midpoint of the program via survey distributed to the trainees to assess factors such as satisfaction with the program and if there are any factors that can be done more efficiently. All program staff will be involved in the assessment of the feedback to make necessary adjustments in the program. Lastly, the outcome will be evaluated via the pre and post test surveys that will be conducted by the general project staff. It will assess trainees' knowledge, attitude, and practices as it relates to their response to substance use and abuse and mentally ill patients to identify that the program made any changes in their responses. As it relates to the timeline, it will begin with the formulation phase that begins in August 2024 and goes to December 2024. It will include the project director recruitment, who will then identify partner agencies as well as recruit other project staff that include the general staff and mental health consultants and nurses. As well as the formulation of the program will also occur during this phase. That would include finding the location, training staff, and obtaining project material. The implementation phase, which will essentially begin in January of 2025, will last to May 2025. That will include the recruitment of EMS trainees from local rural hospitals, as well as the implementation of the program that will last approximately 4 months, going from February to May. Lastly, the evaluation phase will occur simultaneously through the implementation phase, beginning with the pre-test done in February that will be distributed and analyzed in February before the commencement of the program. There will also be a midpoint feedback survey that will be done in March. And lastly, the post-test distribution and analysis that will be at the end of the program. The Purdue Extension team is requesting $200,000. The funding will go towards annual salaries for non-volunteering personnel and other remaining expenditures. More specifically, the salaries of the project director, who will be full-time, 2 assisting staff members who will be considered as part-time, consultants for in mental health, as well as consultants from nursing staff, mental health nursing staff, employee benefits and taxes, that will be approximately 20%, as well as printing that will also be included as the remaining expenditures. I would like to acknowledge and thank Purdue Extension Clinton County for assisting with this program. I'd also like to thank my course partners Ashley Grams and Kylie Shelley for providing feedback throughout this process. I've also listed my references. Thank you for listening to my presentation.